everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I would like to continue my cancer series and talk about insulin potentiation therapy. Insulin potentiation therapy, or IPT, is an intravenous alternative cancer therapy that uses insulin to enhance the efficacy of low-dose chemo. IPT is much gentler than conventional chemotherapy and doesn't come with the horrific side effects patients typically have to endure. Here's a little bit about the history of IPT. Dr. Stephen Iyer is the physician we can thank for bringing IPT to the United States in the 1990s. A family of doctors from Mexico, however, were the ones that invented what is now referred to as insulin potentiation therapy. Dr. Iyer worked alongside these doctors, and the result is the therapy that is used today. Interestingly, IPT is used as a diagnostic tool in conventional medicine. Before a PET scan is performed, the patient is first injected with radioactive glucose. Cancer can be detected by viewing cells that rapidly uptake glucose. So this is diagnostic for cancer. IPT is backed by sound science and empirical evidence and is useful for a wide array of cancers. What is IPT? The effectiveness of IPT lies in its ability to deliver low-dose chemo to cancer cells by using insulin. Insulin is a hormone secreted by the pancreas, and it acts as a potentiate, increasing the efficacy of chemo. Insulin does this by activating receptors on the cell membranes of cancer cells. Chemo agents can then more easily enter the cell, where they can then target cancer cells and prevent their spread. Every cell in the body has insulin receptors that enable glucose to enter. Together with oxygen, this is how ATP, or energy, in the body is made. The mechanism behind why IPT works is the fact that cancer cells have an abundance of insulin receptors, in fact, even up to 10 times more than do normal cells. When insulin is delivered into the bloodstream, these cell receptors open, ushering in the chemotherapy drugs. Cancer cells differ from healthy cells due to their inability to utilize oxygen to produce energy. Because of this inability, cancer cells make energy via glycolysis or fermentation, resulting in their need for copious amounts of glucose to survive. This is why people with cancer should eliminate sugar from their diets. Not only does sugar feed cancer, it also deprives healthy cells of nutrition. And this is because cancer cells gobble up all the incoming fuel first, leaving little for the normal cells. This survival mechanism, along with the abundance in insulin receptors, allows cancer cells to consume more glucose. More insulin receptors equate to more glucose entering the cell. IPT can effectively target cancer cells due to their increased permeability and affinity to quickly bind insulin. Healthy cells don't bind insulin as quickly because they don't have as many insulin receptors, and this is one of the reasons that IPT doesn't harm normal cells. IPT capitalizes on cancer's extreme need for sugar to deliver chemo into the cells. Insulin, which is used off-label as an adjunct to increase cell membrane permeability, is a causal factor behind the success of IPT. Although both insulin and chemotherapy are FDA-approved drugs, IPT is still considered an alternative therapy. Insulin exponentially increases the absorption rates of chemotherapy. This is why the term potentiate is used to describe IPT. Potentiate means to intensify or multiply. Because of this increased absorption rate, much lower doses of chemo can be used. With IPT, only 5 to 10% of the conventional standard chemotherapy dose is delivered. The amount of insulin that is given is equivalent to what the body would secrete just following a normal meal. These low doses of chemotherapy spare the patient immense suffering, while still delivering the cancer-killing benefits. Healthy cells are protected from low-dose chemo because their cell membranes are less permeable because they have fewer insulin receptors. The more receptors a cell has, the more permeable it becomes. This is why IPT is so effective in attacking cancer. Insulin also activates an enzyme called delta-9 desaturase. When this enzyme is activated, it increases cell membrane permeability by desaturating the fatty acids within the membranes themselves. And this allows the chemo drugs to easily enter the cells. There is a therapeutic window in insulin potentiate therapy, and I want to talk a little bit about that. Before receiving IPT, a patient doesn't eat for up to 12 hours prior to treatment. A small dose of insulin is then administered, saturating the numerous insulin receptors on the membranes of cancer cells. These receptors become saturated within 20 to 40 minutes. Then small doses of chemo are administered and absorbed by cancer cells. During this therapeutic window, non-cancerous cells remain untouched because their receptors have not been saturated. This entire process is halted once the person resumes eating. In traditional chemo, large amounts of cytotoxic drugs are used in order for enough of the drug to be absorbed to make the treatment effective. Unfortunately, healthy cells are also harmed in this process, and the immune system takes a huge hit. Because IPT uses lower doses of chemo, treatment can be administered more frequently. This reduces the chances of cancer cells becoming drug resistant while furthering the process of apoptosis or programmed cell death. What are the benefits of IPT? We're all familiar with the miserable side effects of traditional chemo. Nausea and vomiting, extreme fatigue, and hair loss are just a few of the symptoms that are part and parcel of chemo. And it also greatly diminishes the quality of life. The toxicity of chemo is often a factor in the demise of the patient, and in many cases, chemotherapy kills. IPT uses a much gentler approach. The patient receives all the advantages of chemo without experiencing the extreme discomfort so common with high-dose chemo. Another significant benefit of IPT is that the immune system is not obliterated, which is huge. The immune system can then do its job of defending the body not only against cancer, but against infectious organisms, toxic chemicals, radiation, and EMFs. Benefits include lower doses of chemo can be used with IPT. Treatment can be administered more frequently. It does not damage DNA. The immune system is spared. No side effects are noted. Drug resistance is not an issue. Cachexia or muscle wasting is non-existent. Apoptosis is stimulated. It increases cell membrane permeability. IPT is often used for conditions other than cancer. And it increases the potency and absorption of chemo. One potential side effect of IPT is hypoglycemia or low blood sugar. This isn't an issue, however, if the patient is carefully monitored, which they should be. IPT is an alternative cancer therapy that uses insulin and low-dose chemo. Insulin, a pancreatic hormone, opens receptors on cancer cells, which allows chemo to enter, where it can then kill cancer and prevent its spread. The mechanism behind how IPT works is based on human biochemistry and the distinguishing characteristics of cancer cells. It was first brought to the U.S. in the 1990s and is now being used successfully in alternative cancer clinics in the United States, Mexico, and Europe. One such clinic is an Oasis of Healing in Arizona. If you or a loved one have been treated with IPT, I would appreciate it if you'd leave a comment below this video. And I'll put a couple links on 2 books that are great resources that you can learn more about IPT. Thanks for watching.